Hi, my name is Sarah Welsh. I am a teacher with the visually impaired and early intervention specialist. I have a history in applied behavior analysis, and I currently work with children from birth to 3 in the state of Ohio with visual impairments. But I am lucky that I have a unique glimpse into the behavioral aspect also. So, coming from both of those worlds, I wanted to join them because I keep seeing a diagnosis come up on both my behavioral side and my vision side. And oftentimes they can be misdiagnosed or misunderstood as one or the other. Most often, I see children with CVI being diagnosed with autism spectrum disorder, and CVI is cortical visual impairment. My guess is that if you are here as a behavior specialist or like a registered behavior technician, a board certified behavior analyst, any sort of intervention specialist, you have dealt more with the autism piece and likely never even heard of cortical visual impairment. So that is my goal today, is to kind of introduce you to this and just give you a little bit of background on how the misdiagnoses are happening and how you can search for those yourself in your clients, in your children, in your students. Maybe you're working with little with autism, but there might be something else going on, and you just want to be sure that every possible issue is being addressed. Autism spectrum disorder is a developmental disability caused by differences in the brain. We will be talking about the brain a lot in this video because the brain is where both of these disorders are rooted, right? So just differences in the brain, injuries in the brain. People with ASD, autism spectrum disorder, often have problems with social communication and interaction, and they'll have restricted or repetitive behaviors or interests. So we know children with autism often they will gravitate towards the same object, the same interest. They like to play with what they like. They're not interested in something new. They're not interested in new people or topics. They like what they like, and no one can deter them from that. Cortical visual impairment is indicated for children showing abnormal visual responses, but they can't be attributed to the eyes themselves. Brain dysfunction explains the abnormal visual responses, as abnormal ocular structures, abnormal eye movements, and refractive error do not. So this means the eyes themselves, the ocular structures, look fine. They look typical, but the brain is not interpreting what the eyes are seeing. So I might be looking at an object, and I might be sitting with a little one or an adult who has CVI, and we're seeing two different things because my brain is interpreting the object appropriately and their brain is not. So just like autism, cortical vision impairment is rooted in the brain. So the eyes are okay, the eyes are healthy, the brain is dysfunctioning. Children with autism engage in very telltale behaviors. So a lot of children with an autism diagnosis will engage in these same behaviors across the board. They avoid eye contact. They don't like to engage socially, especially with new people. They can't follow a point. So if you were to point across a room, they can't look then and track what you're pointing at. And they also aren't going to point themselves to get you to look across the room. They play with the same toys in the same way for most of their playing time. They're not interested in playing with a new toy or a new person or taking those same toys and playing with them in a new way. They might like to take their cars and line them up rather than driving the cars on a road. Or they might enjoy taking blocks and just putting them in a bucket over and over again rather than stacking them. They are not interested in doing something new. They like to do the same thing. They will focus on parts of objects rather than the object as a whole. Oftentimes, they will engage in movement with the object. So if they have a little car, they might like to look at the wheel. They might spin it with their finger and just watch as it goes. They might take a book and flip the page back and forth, just watching that page go back and forth, rather than turning the page, once, twice, 3 times so that they can read the story and follow those pictures. They're not interested in the pictures or the story. They're interested in that one page flipping back and forth. Children with autism are inattentive. They often don't want to listen to what you have to say. They are in their own zone. They are focused on what they are doing, and they don't want to be interrupted. And they often have delayed motor skills, both fine motor and gross motor. Children with CVI, or cognitive visual impairment, have some very similar behaviors, but they have a different function. But what we're talking about right now is the behavior. So children with CVI will avoid your social gaze. They won't look at you. They don't really like to look at even familiar faces, moms and dads, grandparents. They will report, my child's not looking at me. Why aren't they looking at me? And it's because it's hard for them to interpret a human face. Human faces are so complex. It can be tiring to look at a face. And so rather than look, the child will look away to look at something a little bit less complex, just something a little more simple, to avoid their eyes hurting and becoming fatigued. They respond better to familiar items, again, because it's easier visually. To look at a red bear or a baseball or just something that is the same every single time, they might like to carry that object with them. If you present it, they will immediately react to it, as opposed to presenting a purple bear or a basketball, because they're not used to that. They don't have that memorized in their brain. Their eyes aren't used to seeing it. It's uncomfortable. So they, similar to children with autism, they will look at an object and fixate on it and hold it and not want something else. But that's simply because seeing familiar items is much, much easier for our eyes than it is to look at novel items. Attention to moving stimuli is better than static. So this means if an object is moving, they can see it more easily than if it's standing still. So like we were talking about those wheels, if a child is laying on the floor or just sitting up spinning a wheel, maybe they can see it better when it's spinning. And so it's not about just spinning a wheel arbitrarily. They're spinning it because they are understanding it more easily and their eyes are interpreting it more easily. Same with flipping that page. A little one flipping a book page back and forth, it's easier for them to see it because it's moving rather than just a flat 2D image. And lastly, children have difficulty seeing objects on a visually busy background. So that idea of pointing, if I point across the room at something and a little one with autism might not look, because they're busy and their brain is working on something else. But a little one who has CVI, they might look and they can't follow that at all because the background, the room is just overwhelming for them and it all starts to blur together. And so they don't follow the point because they can't. It hurts their eyes, it hurts their head. They just cannot interpret what they are looking at. So some of the causes of CVI are listed here. They all engage the brain. So CVI is always caused by damage to the brain. You might hear it called neurological vision impairment, cerebellum vision impairment, but cortical visual impairment is what we are calling it in the TVI world, and we are moving towards that kind of as a whole. So seizures at birth or seizures in childhood, infancy, those can cause damage to the brain, which can then cause damage to those parts of the brain that interpret what your eyes are seeing. Premature birth, this comes with a whole slew of complications. And as we advance our medical abilities, children are being born earlier and earlier. But what we know is that vision is the last thing to mature and the last thing to develop fully. So if you are born premature, you're likely going to have some vision concerns that we just need to monitor as you get older. Brain injury, so if a child has shaken baby syndrome or is dropped or falls, that can damage the brain, which again can damage the vision piece of the brain. HIE is lack of oxygen at birth, and this is hypoxic ischemic encephalopathy. So this is just if a little one is born maybe with a cord wrapped around their neck and they can't breathe and they aren't getting oxygen to the brain, so their brain is damaged and they're unable to use the vision portion of their brain. And then lastly, any sort of infection. So if a child is exposed to infections or anything sickly while they are in utero. So if the mother has a disease, a sickness, an illness, anything really serious, that could cause the child any sort of brain damage. So when do you consider CVI? If you're working with a little one with autism, at what point do you start thinking, is this more than autism? Is this something else? I'm just going to give some examples. I want you to think about when you're seeing the problem behavior, where you're seeing it, and what's the medical history of the child. If you are seeing the problem behavior more when they are tired, more when they have been maybe exposed to a lot that day, and their eyes might be tired from looking at novel items, new environments, meeting new people, think about that. Think about what they're being exposed to when they're engaging in these. Is it a new person? Are they avoiding looking at the faces of new people, but they will look at the faces of familiar people? What about the stimuli that you're giving them? So are they reacting badly or engaging in disruptive behaviors when you present them with something that might be overwhelming visually? Is it a solid color or are there lots of patterns? Is it red or yellow, which we know little ones with CVI can see more easily? Or is it a whole slew of greens and purples and blues, maybe not really any consistency or great contrast? So you want to think about those things. One example is I had a little one I was working with, and he would absolutely just come. He would be really frustrated and engage in problem behaviors at much higher rates when I would give him a black and white highlights magazine search and find picture, which if you are familiar with them, they have very, very busy scenes that you need to look and find small items, right? They are intentionally visually complex. I would give this child this stimuli and he would crying, screaming, eloping. He just did not, this was so aversive to him. So I started asking myself, well, it's when I present this stimuli, what else could be going on? And that's when I thought, okay, this little one has autism, we know that, but maybe he has CVI. And that is when I found out he did have brain trauma at birth. So there was that correlation. And it made sense that CVI was likely another cause. So where are you seeing this problem behavior? We are thinking, when is it after stimuli being presented? Is it when they are presented with new people or socially exhausting environments? But what about where? So if this child is in a new environment, look around. So are the walls really colorful? Are they busy? Are there pictures everywhere? Is the room all the same color? So if you are in a living room and there is a beige carpet, a beige couch, a beige wall, and they can't see if where one thing ends and another begins, that could also be confusing. They don't know where they are in space. They're unable to interpret where they are and what their eyes are seeing. And then lastly, what's the medical history? Is there a history of brain trauma? Is there a history of brain injury? If you're able to, ask the parents, how was their birth? Just give me a little bit of information about that. Was there any sort of oxygen depletion or lack of oxygen or a brain bleed or a seizure at birth that could have caused some sort of brain injury to the child, either at birth or shortly after? This was a very, very quick intro and overview of CVI and autism and the overlap of the two. But I wanted to get something out there because the longer I spend time in the behavioral field and the field of vision loss, the more I see this, coming out and overlapping, and people just aren't aware of it. There is very, very little awareness of CVI, and it is the number one cause of vision loss in early childhood. It can happen later in life. It can happen to adults if you have brain trauma or a traumatic brain injury. Any sort of impact to the brain can cause CVI, but it's really being seen in early childhood and is often misdiagnosed as autism. And when it's misdiagnosed, we aren't able to treat it the way it needs to be treated, and we are missing crucial weeks and months and years of early intervention that could possibly allow this child to gain functional vision back at a normal or almost normal rate. Because what we know about CVI is because it's our brain and because the pathways in our brain are a little bit malleable, and they're even more malleable when we're young, we can help the child make sense of the world visually and reframe and recreate those pathways so that they can use their vision more appropriately and access the world around them. So if you have any questions, please feel free to email me or reach out. I would love to hear from you and your experience with children with autism, children with CVI, little ones in general. Yeah, have a great day.